Welcome to my channel Medicine Guide. Mupirocin, Bactroban, Ointment. Mupirocin, Bactroban, 2% ointment is a 2% mupirocin-free acid in a polyethylene glycol base for topical administration. Mupirocin has bacteriostatic properties at minimum inhibitory concentrations and bactericidal properties at the higher concentrations reached when applied locally. In this video we will discuss the mechanism of action and other pharmacology of mupirocin. So let's start our discussion, but before that please subscribe to my channel Medicine Guide. Now let's start with mechanism of action. Mechanism of action of mupirocin. Mupirocin is a novel antibiotic produced through fermentation of Pseudomonas fluorescens. Mupirocin inhibits isoleucyl transfer-RNA synthetase, thereby arresting bacterial protein synthesis. Due to this particular mode of action, and its unique chemical structure, mupirocin does not show any cross-resistance with other clinically available antibiotics. Pharmacodynamic effects. Mupirocin is a topical antibacterial agent showing in vivo activity against Staphylococcus aureus, including methicillin-resistant strains. Epidermidis and beta-hemolytic streptococcus species. The in vitro spectrum of activity includes the following bacteria. Commonly susceptible species: Staphylococcus aureus, Staphylococcus epidermidis, coagulase-negative staphylococci, Streptococcus species, Haemophilus influenzae, Neisseria gonorrhoeae, Neisseria meningitidis, Moraxella catarrhalis, Pasteurella multicida. Clinical efficacy has been demonstrated for susceptible isolates in approved clinical indications, including beta-lactamase-producing strains and methicillin-resistant strains. Resistant species: Corynebacterium species, Enterobacteriaceae, gram-negative non-fermenting rods, Micrococcus species, anaerobes. Now we discuss the indications of mupirocin. Indications, uses. Mupirocin, Bactroban, 2% ointment is indicated for the topical treatment of primary and secondary bacterial skin infections. Primary skin infections: impetigo, folliculitis, furunculosis, and eczema. Secondary infections: infected dermatoses, e.g., infected eczema, infected traumatic lesions, e.g., abrasions, insect bites, minor, not requiring hospitalization, wounds and burns. Prophylaxis. Mupirocin may be used to avoid bacterial contamination of small wounds, incisions and other clean lesions, and to prevent infection of abrasions and small cuts and wounds. Dosage, direction for use. Populations: adults, children, elderly, hepatically impaired. 2 to 3 times a day for up to 10 days, depending on the response. Renally impaired. Consult doctor for precautions. Method of administration. A small quantity of ointment should be applied to the affected area with a piece of clean cotton wool or gauze swab. The treated area may be covered by a dressing. Do not mix with other preparations as there is a risk of dilution, resulting in a reduction in the antibacterial activity and potential loss of stability of the mupirocin in the cream, ointment. Contraindications. Mupirocin, Bactroban 2%. Ointment should not be given to patients with a history of hypersensitivity to mupirocin or any of the constituents of the preparations. Special precautions. In the rare event of a possible sensitization reaction or severe local irritation occurring with the use of mupirocin, Bactroban, 2% cream, ointment, treatment should be discontinued. The product should be washed, wiped off, an appropriate alternative therapy for the infection instituted. As with other antibacterial products, prolonged use may result in overgrowth of non-susceptible organisms. Pseudomembranous colitis has been reported with the use of antibiotics and may range in severity from mild to life-threatening. Therefore, it is important to consider its diagnosis in patients who develop diarrhea during or after antibiotic use. Although this is less likely to occur with topically applied mupirocin, if prolonged or significant diarrhea occurs or the patient experiences abdominal cramps, treatment should be discontinued immediately and the patient investigated further. Avoid contact with the eyes. If contaminated, the eyes should be thoroughly irrigated with water until the ointment residues have been removed. Renal impairment. Polyethylene glycol can be absorbed from open wounds and damaged skin and is excreted by the kidneys. In common with other polyethylene glycol-based ointments, mupirocin, Bactroban, 2% ointment should not be used in conditions where absorption of large quantities of polyethylene glycol is possible, especially if there is evidence of moderate or severe renal impairment. This mupirocin ointment formulation is not suitable for ophthalmic use, intranasal use in conjunction with cannulae and at the site of central venous cannulation. Ability to perform tasks that require judgment, motor or cognitive skills. No adverse effects on the ability to drive or operate machinery have been identified. Use in pregnancy and lactation. Use in pregnancy. Adequate human data on use during pregnancy are not available. Studies in animals do not indicate reproductive toxicity. Bactroban cream. Mupirocin should only be used in pregnancy when the potential benefits outweigh the potential risks associated with treatment. Use in lactation. Adequate human and animal data on use during lactation are not available. If a cracked nipple is to be treated, it should be thoroughly washed prior to breastfeeding. Adverse reactions. Adverse reactions are listed as follows by system organ class and frequency. Common. Greater than or equal to 1/100th. Less than 1/10th. Skin and subcutaneous tissue disorders. Common. Burning localized to the area of application. Uncommon. Greater than or equal to 1/1000th. Less than 1/100th. Skin and subcutaneous tissue disorders. Uncommon. Itching, erythema, stinging and dryness localized to the area of application. Cutaneous sensitization reactions to mupirocin or the ointment base. Very rare. Less than 1/10,000th, including isolated reports. Immune system disorders. Very rare. Systemic allergic reactions including anaphylaxis, generalized rash, urticaria and angioedema have been reported with mupirocin ointment. That's a no for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, The information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.